Hi there. Thank you so much for joining us today. I'm going to take the majority of this presentation, but Luke will be here to help with any questions as well. We're going to be chatting about the prevalence of AI in healthcare today, one of my favorite topics to talk about. And like Ali said, if you got any questions, feel free to throw those in the chat. I'd be happy to address those. First up, our quick disclaimer just with our grant information, if you're curious about that. So, who am I and why should you listen to me? So, I am part of the Upper Midwest Telehealth Resource Center. So, we are a program of the Indiana Rural Health Association. So, I'm part of IRHA, even though I mainly serve as a program coordinator for the UMTRC. And we are unique in the fact that we do not just cover Indiana, we also cover Illinois, Michigan, and Ohio. And we serve as kind of our telehealth clearinghouse for that portion of the country. We're part of the National Consortium of Telehealth Resource Centers, or the NCTRC. And we have 12 regional TRCs that cover the whole US as well as all of our territories. The Upper Midwest is just our region. And essentially, what we do is we provide telehealth technical assistance to folks. And that can be anything from very general questions like, how do I start a telehealth program? Or even something as simple as, what is telehealth? What can it be used for? To things that are much more specific, like how do I use this specific code for this specific circumstance and billing in my state? And because of the increasing prevalence of digital health and AI, we're also becoming sort of experts in that field as well, which is why I'm going to be talking about AI and its prevalence in the healthcare field today. So that's a bit about the UMTRC. So we'll get started. So first up, we're going to spend a little time talking about artificial intelligence within the healthcare landscape. And we'll start by going over the very basics of AI, and then we're going to move into more of where AI is being used today, and then more of where AI is being used in healthcare. And this is something that's really exciting. We've seen a lot of big advances recently, and we'll go over those now. So the main point of this section and this presentation as a whole, honestly, will be to understand the perception of AI in our current, healthcare landscape versus the reality. And this can happen in a couple different ways. So the perception of AI is something that some folks appear to believe that it's like magic, like there's no limits to what it can do. And that's on one end of the spectrum. And then we have folks who are very, they don't really buy into the hype so much and don't think it's really a helpful technology or a novel technology. And my goal today is to really hone in on what the reality is and talk about why the perception and reality are so very different. So we'll start by talking a little bit about AI 101. So AI may sound complicated, but at its core, it's all about using computers to learn and then to make smart decisions. So here's a very simple breakdown in 5 steps of how it works. So first of all, we're going to input data. So AI is going to start its process by taking in information, and this can be text, images, audio, numbers, or just about anything. So a good example, especially when we're talking about the healthcare landscape, is radiologists putting in a bunch of images of broken bones and healthy bones. So that's the data that we're putting in. Next up, we have learning. So AI uses the data that has been inputted in our first step to learn about patterns. It looks at a ton of examples to figure out how things usually work. So for instance, it might be able to identify a broken bone versus a healthy one by saying, oh, this broken bone doesn't match the pattern of the healthy bones that I have been trained on. So during the training, the AI is given a huge amount of labeled data, like photos, like I said, of a healthy bone versus a broken bone. And it's going to review those as like positive or negative. So it's going to use this data to build a model. It's kind of a set of rules or formulas to help it understand future information. So once it's been trained, that's when we move on to making predictions or decisions. So the AI can start making predictions or decisions based on new data. So we're going to be able to start putting in x-rays, images that it was not trained on, and it's going to start saying, oh, I have been able to identify this particular image as a broken bone or a healthy bone because of my training and the information I have access to. So good AI systems are going to keep learning and getting better as they are exposed to new and more data. The more data they see and the more feedback they get, the more accurate and helpful they're going to become. So it's like they're always practicing and getting smarter. So that is a very base level explanation of how AI is going to work. So who thinks that they're using AI today? So most Americans, around 90%, have heard about artificial intelligence, but only 1 in 3 are going to say they know a lot about it. So in this same survey, which included over 10,000 US adults, it found that 27% say that they use AI several times a day, 28% think they use it once a day or a few times a week, and then 44% say they don't use it regularly at all. So this is demonstrably going to be something that's incorrect. So people, only about 30% of US adults who were surveyed here were able to correctly recognize all 6 examples of AI utilization in everyday life. So about 70% were able to say, oh yeah, a wearable fitness tracker that analyzes exercise and sleep patterns is going to be AI, but only around half of folks were able to recognize that an email service categorizing incoming emails as spam was also going to be AI. So overall, there is a perception that AI is much less common than it actually is. So talking about who actually uses AI. AI is going to be present in many aspects of daily life. Like we said on that last slide, things like fitness trackers are going to use it. If you wear an Apple Watch, you probably utilize AI. Things like email filters. And I know we all have a colleague who is absolutely devoted to utilizing Chat GPT. So things like this, whether you're using them sort of incidentally or deliberately, there's going to be AI present in multiple aspects of daily life. Excuse me. And beyond just the individual, companies are going to be increasingly reliant on AI technologies as well. Recent survey found that about 40% of global companies report that they currently use AI in some capacity. And then around 82% of companies report that they are using or exploring the use of AI in their organization in the near future. So we see the utilization of AI has been increasing across the board. So now let's move on to healthcare. Where is AI currently being used? So first up, we have diagnostics, and this is the one that I referenced a lot in that first slide with that first example. So that's going to include things like radiology, breast cancer identification. And an important thing to note here is that AI is not working alone or working in a vacuum. Human and AI technology are frequently working together here. So diagnostics, AI can be an extremely useful tool for identifying trends and making conjecture, making initial guesses, but it needs a human element to work. You're not just going to turn over an x-ray of a patient to an AI tool and release the results to them without at least looking at it, just to ensure that everything is going well and that the tool is operating as it is intended to. One theme throughout this presentation and throughout my general experience with AI is that it's a fantastic tool, but at the end of the day, it is a tool. So next up, triage. This is something that is being sort of developed right now. So triage can be utilized to remove bias from a situation to treat the highest need first. So a good example of this is stroke care. So if you have a patient, AI tools can allow for quick identification of stroke symptoms and then can suggest quick care, oftentimes if you don't have a specialist available. So we have seen AI be quite successful in assisting with triage where stroke care is concerned. And then last, but certainly not least, administration is a place where AI can really shine. So we've seen AI tools be able to assist with scheduling. And then we've seen them be able to be used for common patient questions. We can route that through an AI chatbot. If things get more complicated or if the patient is unclear, we can route that to a nurse or provide another provider. Another way it can be really useful is note taking in appointments. So if a provider is seeing a patient, they're able to turn on their AI note taking tool. And rather than having to look between the patient and the screen just to like take all their notes, they're able to utilize an AI tool to do that for them. And that can cut down on a lot of administrative stress, which is great. AI tools can also be useful for cross-referencing previous appointment notes and identifying trends. AI really excels when identifying trends and patterns, and this is a place where it can be used to great effect, particularly when we're talking about things that require a lot of data maintenance, like remote patient monitoring tools. And another reason why administration can be so great is because it can really cut down on provider time spent on non-patient interaction activities. We'll talk about why that's important in a sec here. Yeah, so our uses in healthcare about where AI is going to be utilized the most practically. So many of our more complex uses of AI are still being studied and considered. They're still being developed. We're still determining where it's ethically appropriate to utilize them. But administration is immediately practical. Excuse me. So things like scheduling, we're able to immediately institute AI solutions there because there's not as much of a risk of them going wrong. If a scheduling AI tool is unable to be used correctly, it's pretty easy for a human administrator to step in and to fix that. And the worst that happens is a patient misses an appointment or has an appointment scheduled incorrectly. Same with billing assistants. AI tools are able to help with that. Note taking, as I mentioned earlier, and chatbots that are able to perform kind of a triage of more complicated questions. So a provider isn't answering the same question about the common cold over and over again. So it's incredibly helpful because it does cut down on provider workload to allow for more patient care. And we have seen increasing provider shortages across the board, particularly in high need areas like rural areas. And so us being able to utilize these AI tools there to sort of cut down on the amount of administrative work that's needed, that can be incredibly helpful for these providers that already have a high patient load. So let's talk about where AI is unable to be used or unable to be used independently. So whenever we talk about AI utilization in the healthcare landscape, it's important to consider medical ethics. So there are concerns of responsibility and fairness. And what that means is that at the end of the day, a machine cannot take responsibility for a decision. If a care decision is made purely by an AI tool and that ends up being the wrong decision, there's not a lot of accountability there, which is what a lot of both advocates of AI and opponents are aware of and do why they advocate for sort of the oversight by a physician. And then there's the black box nature of algorithms that can lead to concerns. I am not, I am an AI advocate. I spend a lot of time reading about AI, learning about it, but I do not understand the deep sort of connections and workings of every AI algorithm. No, even an AI engineer couldn't. So there is a level of sort of obfuscation there that can lead to some concerns. And then this all comes down to medical decision making. Like I said before, AI cannot take responsibility for medical decisions. And when a patient is not aware that AI is being utilized, or they're not aware of how it's being utilized, trust between a patient and provider, which is vital for ensuring that care is both delivered effectively and then care decisions are respected by a patient, that can be incredibly damaged by utilization of AI that's either not disclosed or not well understood. So now let's spend some time talking about the consequences. And consequences may be too negative a word because not all of the outcomes here are going to be negative. But it's important to understand sort of the concerns, the security considerations, what it means that AI is so prevalent in our current healthcare landscape. So, first thing to understand, AI is here. This box is not being closed again. It's not like we can say, okay, we're not using that anymore. It's just too prevalent. It's been too accepted. So, we're moving forward. We're not moving back. AI is here. Now what? Let's talk about now what. So first up, we need to identify our patient concerns when we're utilizing AI. How do patients feel about this? So some of the concerns they have are related to not wanting to be misdiagnosed by an AI tool. They're worried about privacy breaches, not having their information correctly secured. They're worried about less time with their doctor, and they're also worried about increased cost. But thankfully, a lot of times increased costs can be offset by the utilization of the technology and AI tools. And also less time with the doctor. Like I said before, a lot of administrative tasks can be taken care of with AI. So you might conversely get more time with your doctor, which is great. But awareness, on the other hand, is also a big problem. So around 80% of patients don't know if their provider uses AI or not. And then 3 out of 4 patients don't trust AI in healthcare. So this is a big gap between how frequently we've seen AI used and patient awareness of it and patient trust in it. So let's talk about some of the reasons why that is. So we discussed this briefly before, but I'm going to continue to talk about it because it's extremely important. So can a machine take responsibility is the big question here. There are going to continue to be ethical concerns as long as we're utilizing AI and as long as we have sort of shaky legislation around it. We'll be talking about that in a bit here, don't worry. So there are higher stakes in medical practice. If I'm utilizing like an AI algorithm on Spotify to recommend me songs, and it recommends a song I don't like, that is obviously not life threatening. But if an AI tool makes an incorrect diagnosis or suggests an avenue of care that is not correct, that is obviously going to have consequences for my life and my health. So, misdiagnosis, like I said, can mean incorrect care decisions and dire consequences for a patient as well as for a provider. So, there are a lot of questions right now around the ethics of utilizing AI. So, AI often serves to augment a provider's capabilities, not replace them. That's when it's being used correctly and most responsibly. So, there's also the issue of bias within healthcare overall, but within AI specifically. So, bias exists, and we talk about how sometimes triage via AI is utilized to address bias within the healthcare system. But unfortunately, AI also has bias baked in because of the data sets used to train the tool. If I am utilizing a data set to train my AI tool that doesn't include certain vulnerable populations or even large populations, there's been instances where AI tools have been trained without using any data from women at all. Things like that. That is obviously going to skew our results if the data we use to train an AI tool does not reflect reality. So now let's move on from that a little bit and talk about AI and security and some of the dangers that can go along with this. So AI powered cyber attacks use artificial intelligence to conduct attacks that are more sophisticated and more difficult to detect than traditional cyber attacks. So AI is a great tool to be used for good, but it can also be used this way, which is something we should be aware of. And then let's talk about adversarial attacks. Those are going to target AI models by manipulating input data to trick the system into making incorrect decisions or providing harmful outputs. So they're going to exploit vulnerabilities in the model's algorithms by injecting inputs that appear benign to the model, but lead to more undesired outputs by the AI. Next up, we have data manipulation, which is pretty similar. But this is going to compromise the integrity of the training data used in the AI model. So if I'm putting data that's incorrect into my model when I'm training it, like to use the example from earlier, if I'm showing my AI model a bunch of pictures of broken bones and saying these are healthy, obviously the output from our AI is not going to be accurate or correct. So that can be a huge problem if we're relying on this tool to help us make decisions. And then we have model theft. This is something more related to propriety and that kind of thing. So that's where attackers are going to aim to replicate and steal proprietary AI models. So they're going to be able to understand and exploit the model's weaknesses, as well as disable safeguards and use it for criminal purposes, as well as just copying an AI model that they did not develop themselves. Excuse me. And next we have model supply chain attacks. Those are going to target the components involved in the development and deployment of AI models. And they're going to compromise the integrity of AI systems by injecting malicious code or data into third-party libraries, training data sets, or during model transfer process. So this is just another way to make it so the results you're getting from an AI tool are not correct and accurate. And last but not least, this is an issue with all technology. Surveillance and privacy are going to be a concern. With AI, a lot of times AI technology can be used to monitor individuals. And if it's happening here, it's happening without their consent. So here are some of just the common dangers when we're utilizing AI. So let's talk about those vulnerabilities. So first of all, we have integrity risks. So these are when, and a lot of the dangers that we talked about on the last slide are going to contribute to these specific risks and vulnerabilities. Excuse me. So first of all, we have integrity risks. So these are going to be results from an AI model that are incorrect, either unintentionally or through deliberate manipulation by adversaries. And these integrity risks can occur for a wide variety of reasons. I talked about data poisoning. That's when we're going to get the wrong answers because of the data that has been fed in, even if that data initially is going to seem benign. So my example earlier, if I'm showing a tool that's training on diagnosing a broken bone, if I'm showing that a bunch of pictures of broken bones and saying they're healthy, that's an integrity risk. So next up, confidentiality risks. That's going to be results from an AI model that reveal elements of input data. So when data is inputted into an AI system, if it's a large enough data set, it is expected to be anonymized. But sometimes the proper precautions and safeguards are not taken. And so we end up with unsecured data out there. And so folks are able to get at sometimes protected health information and that kind of thing. And obviously that's not ideal, particularly if somebody thinks that their data was being anonymized before it was put into an AI tool. And then we have governance risks. And that's if our governance system of our AI governance system is not behaving correctly. So we have results from an AI model or the usage of a model in a system that's going to have adverse impacts on the context of applications. So this is by no means a complete list of the number of dangers and those vulnerabilities that occur around the utilization of AI tools, but these are some of the common ones. And it's important to note that the security vulnerabilities here, the vulnerabilities that exist around utilizing technology within the healthcare system overall are still going to exist here. Utilizing AI does not lessen your risk of a data breach in most cases. Oftentimes it can make it worse because you're having more technology, more data, more protected health information being controlled. So important thing to know. So let's talk about some of the consequences of not accurately or responsibly treating data or treating your AI. So first of all are our consequences for patients. So obviously our big one, it can be loss of control of personal information. I've had my identity stolen. It's not a fun thing to deal with. And if we're not correctly securing our data utilized for our AI tools, and if we're not taking the proper precautions, instituting proper safeguards here, we're going to see this happen to patients. And then if we're talking about the more integrity risks related to data poisoning and that kind of thing, Incorrect information could be given from a provider if they're not being responsible with how they utilize their AI systems. So you might be getting a misdiagnosis. You might be getting incorrect treatment decisions. So there's a lot of different risks here, and the consequences need to be understood so we can utilize AI responsibly in our care. So next up are some consequences for providers. So first of all, if we have an integrity vulnerability that's happening, there's going to be a loss of patient trust there. If your provider gives you incorrect information or they like advise you to do a certain thing with your care that ends up being wrong or incorrect later because they relied on an AI tool, that's going to lose a lot of that trust and it's going to make care very difficult going forward. So potential incorrect diagnosis or treatment is going to be a huge problem here. There's also financial and reputational risks of giving incorrect information or of losing access to information. It's a big problem. And last but not least, we have our organizational risks. So there will be financial and regulatory consequences a lot of the time. So data breaches cost a lot in the healthcare industry. So healthcare data is sensitive and very regulated for good reason. So breaches can result in big fines, increased scrutiny from regulators, and costs are just going to increase like by a ridiculous degree. So financially, you're going to have to deal with the direct cost of responding to a breach, legal fees from lawsuits, fines for HIPAA violations or other regulatory penalties, increased insurance premiums, lost revenue. And there's also going to be that erosion of provider and patient trust if the proper steps are not taken to ensure that data vulnerabilities are caught and addressed. So you might lose providers, you might lose patients, and that's to say nothing of like the legal consequences related to like HIPAA and all that good stuff. So how are we able to sort of mitigate these risks or at least be aware of them? So first things first, let's protect our patient data. So there are two ways to do this. So update technology and security whenever appropriate, but that's not the only thing. Personnel also needs to be educated. It doesn't matter if you have the best new system with the best new bells and whistles if your staff is constantly falling to phishing attempts. So this is a two-pronged approach. You need to make sure that the technology and security that you have is up to snuff, but you also need to make sure that your personnel understand why it's important to protect data and how to utilize their AI tools responsibly and how to identify risks that exist there. So a way we can do this successfully is to consult experts. AI data security is very fast evolving. This is something where you're going to see a new article about the best way to secure data utilized for AI every week, every day at this point. So we need to consult with our experts because providers are not cybersecurity experts. They are experts on providing patient care. So if they use AI, they need to consult with experts. They need to have that sort of line of communication open and available to ensure that the data they're using is safe and that they're utilizing it responsibly. And last but not least, I'm a planner. I like to plan things. And we should all be planners when we're talking about security. So plans need to be made for when the worst happens and what we do in response. That's vitally important. Nobody wants to think about the worst day of their organization when all of their security is breached and they lose all their data, but there needs to be a plan for what happens when that eventuality, or if that eventuality does come to pass. So last but not least in this section, let's talk for a second about AI and patients and why communication matters so much. So patients are going to have questions about their providers utilizing AI, especially if providers are open about the utilization of AI, which they should be to foster that trust. So patients are going to ask things like, what is this AI doing? Why are you using it? Is it responsible for my care decisions? So providers should have answers to these questions. And one thing that is always important to know is that patience matters. So this is something that as somebody who works in the telehealth world, I come across frequently. Digital literacy is vitally important for understanding how things like AI work and understanding how things like telehealth work. Um, and you can't assume that folks know everything that you know, even if it seems very basic. Can't assume that a patient knows how to use a tablet, knows how to use a smartphone, knows how to use telecommunications technology, because sometimes they don't. And if they are treated dismissively, or if they're not given proper instruction, a lot of time the trust between them and a provider, them and even a method of care delivery, is going to be irrevocably damaged. So patience matters, and explanations, simple explanations of what AI is, how it's being utilized, and why it's okay and it's not like ultimately making care decisions. Those explanations need to be readily available for patients when they ask, because if someone is scrambling for an explanation of how something is being utilized, even if it's entirely above board and ultimately beneficial, not having that explanation ready is going to damage credibility. So now let's spend a few minutes talking about how to prepare for the future. So, like we said before, AI is not going away. So, how do we prepare to use that responsibly going forward and effectively? So, what's up next? There's a lot of things that go into this. One, our legislation, um, how we take responsibility as both providers, public health professionals, just folks who work and exist in the healthcare space and the public health space. What do we do next? So let's talk about AI legislation. Legislation, my favorite topic. So the United States does not have comprehensive federal legislation specifically regulating artificial intelligence at this time. But there is a growing movement towards AI governance. So right now, what we have is a mix of federal and state level initiatives, executive actions, and industry self regulation. And it's got a focus on safety, fairness, and transparency, which is great. But unfortunately, these things tend to move pretty slowly. If you're familiar with telehealth, for example, something that has been utilized quite a bit, especially since the COVID-19 pandemic, we do not have permanent legislation allowing telehealth. We are operating off a existing series of like continuing resolutions and extended waivers that have been extended for many years. So this is something that unfortunately we're probably not going to see big, like sweeping and definitive legislation for some time yet, especially because this technology is all developing so quickly. So currently, no overarching federal law that dictates AI development or deployment. But like I said, various bills, initiatives address aspects like risk management, data privacy, and then like things like election integrity, all that good stuff. So related to deploying AI-based technologies in the healthcare sort of industry. So there are no specific regulatory pathways for AI-based technologies in the US, but the Food and Drug Administration, the FDA, is currently the entity responsible for regulating them under existing regulatory frameworks for medical devices. Because there has been sort of shakeups in the FDA and surrounding agencies, it's impossible to say if that's going to remain the same way, but right now, to the best of my knowledge, to what I found when double checking last night, the FDA still regulates AI devices the same way that it regulates other medical devices, and determines whether or not they're able to be deployed. So that's where we are in the federal level. State by state, though, we have seen movement. State by state regulations are being passed to address the usage of AI, particularly the usage of AI in the medical field. So the clinical use of AI and physician oversight is a big one. A lot of different states are currently working towards passing laws about this or already have. I believe Texas is one, Illinois is another. Indiana doesn't have anything right now, but we will keep monitoring that. So states are increasingly introducing language that would require physicians to provide oversight and review of any AI tools used in clinical decision making. So this honestly feels like a no-brainer in a lot of ways. So it's just saying, hey, if an AI tool is making a care decision, a physician has to look it over and say, okay. So it's looking over that report that says this bone is broken, this person does have cancer, that kind of thing. So no care decision is being made in a sort of AI vacuum, which is not a problem in most cases. So let's talk about how we can take responsibility for the usage of AI. So first things first, transparency is vitally important, regardless of how you're using AI, even if it seems like silly, like a chatbot or something like that. Providers and organizations should be clear about that use. So patients should know when AI is being used. Providers should also know when AI is being used in their organization. That transparency fosters trust. That goes both ways. So just be transparent about the usage of AI. It shouldn't be something that feels shadowy or secretive. That's how we breed mistrust. And that's how we just sort of contribute to misunderstandings overall. So next up, accountability. So care decisions are accountable to providers at the end of the day. If a mistake is made, there should be a provider there who says, yes, that was my decision. That was my mistake made. Conversely, if a good decision is made, providers should be able to take ownership for that as well. Also, when we're utilizing our AI tools, there needs to be a constant effort to ensure that the AI being used is non-biased and accurate. We need to look over the sort of decisions that AI is making on a macro level to ensure that they're not recreating existing biases or issues. And if they are, that's something that we need to look deeper at. We need to say, okay, what data set was our AI tool trained on? And is that data set missing out on a significant population? Do we have all of our vulnerable do we have all of our vulnerable populations accounted for? Are we ensuring that the data that this AI tool was trained on is complete and accurate? That's how we ensure that accountability is being maintained. And of course, security. We need to invest in our security, be that with man hours, money, just sort of buy-in at all levels of all our organizations. We all are a part of ensuring that security is being maintained. Personnel needs to be trained on security, both AI specific and more general. Consequences need to be understood. If we understand how serious consequences are, hopefully we'll all move forward together, putting effort into making sure that security is a priority. Yeah, so those are just some of the ways that we can ensure that AI is being used responsibly in our upcoming future. There's a myriad of other ways, but these are some really good places to start. So the future of AI overall, I think it's important that we remain positive, but that we also stay practical. AI is an exciting opportunity. Like I said, I think it's really interesting. I'm really excited about its usage in the healthcare landscape going forward. But at the end of the day, it's a tool. It is a great tool, a tool to enhance care and care delivery in a lot of different ways. And I think we've barely scratched the surface with what all of those different ways are. I'm excited to see the myriad of different ways that we're going to be utilizing AI 10 years from now to help mitigate our provider shortages and to ensure that care is being delivered more equitably. But it's always a tool, never a provider. At the end of the day, our providers are our best resources, and they need to be the ones making the decisions. So the best uses of AI are enhancing a provider's ability to deliver high quality, accurate care, never replacing. So healthcare can lead the way in this space in a lot of ways. So the decisions we're making here are high consequence, but they're also high impact, which is important to consider. And because this is such a high consequence, sort of high impact area, new opportunities are always going to be emerging in this space, which is great. So here are our key takeaways from today. If you remember anything, remember this. So AI is here to stay at this point. It's not going anywhere. We can't go back in time. We can't put this back in the box. So let's use it. And it's our responsibility to make sure that it's used appropriately and responsibly. Um, it's here, we're using it, let's use it responsibly. And AI is always going to keep advancing. And the way that we interact with it and use it should as well. So here's some information from us at the UMTRC. If you want to find out more about us and what we do, I would advise you to check out our website at umtrc.org. We have a lot of great resources up there. For example, we just put up a new bunch of guides about reimbursement for all 4 states in our region. So you got questions, check it out. Also, feel free to reach out to us at info@umtrc.org. If you have a question about digital health, telehealth, anything I talked about today, please reach out to us. Always happy to talk. And then there are all of our social medias. So yeah, if you've got any questions, I'd be happy to address those.
I think one of the most stark things for me, and you did touch on it, Danielle, when people say, like, oh, I'm not using AI at all, or I'm using it infrequently, how many of the apps and like all the Microsoft suite of products and everything already have it built in without much fanfare. I suspect quite a bit of that is true for hospitals and the software and equipment they're using as well.
Yeah, that's kind of why I wanted to give this presentation, just because I was so blown away talking to some of our vendor contacts about how present AI is in all of their products, like their RPM devices, like all of that stuff. It's just, it's everywhere. It's everywhere at this point.
Truly. Well, I'm not seeing any questions come in. So, everybody, thank you for your time. Danielle, Luke, the whole UMTRC team, thank you for being willing to come on and share this great information with us.
Always.
I was just going to add, if you do have specific legislative or regulatory concerns surrounding this or any of the digital healthcare continuum, please don't hesitate to reach out. Danielle made the very good point that while the federal level, whether that be Congress or any other agency has been kind of hesitant to enter the space, from a process-oriented level, just in the year 2024 alone, there were over 600 AI-centric bills introduced at the state level. And we have already surpassed that in just the first quarter here of 2025. So we anticipate, at least at the state level, to be monitoring fast and furious activity, and we'll keep you posted.
Thank you. And thank you, everyone. Enjoy the rest of your day.